I'm Louisa Barton from the Horse Talk Show, and we're here on location at Peterson and Smith Equine Hospital in the horse capital of the world, Ocala, Marion County, Florida. And we have Dr. Adam Cayot here, and we're going to chat about something that's come up recently in the news. Sadly, in Wisconsin, some horses died from Blister Beetle, and some others were actually left very, very ill. It was a very sad situation. I'm going to talk a little bit to Dr. Cayot about the Blister Beetle, and having done some research and studied up a little on this, apparently one of the biggest issues is when hay is cut and baled at the same time rather than left to dry, and the blister beetles get stuck in the crimper, and it's hard for them to get out, and they can be very, very harmful to horses. So I'm going to talk to Dr. Cayot a little bit about that. Dr. Cayot, how are you?
I'm well. How are you?
Lovely to have you back with us. Tell us a little bit about your experience with the blister beetle.
Well, luckily, I don't have a lot of experience with the blister beetle, but the blister beetle is it's a nasty little thing. It's very toxic to horses. Even a ingestion of a little bit of the body of the beetle can be can make a horse very sick. So. The thing that makes the horse the sickest is the poison, which is called cantharidin, and it shows up as it causes ulcerations, typically of the mucosa of the mouth, can cause ulcerations of the digestive tract, and depending on how much the horse ingests, that kind of determines the severity of the problem. It can be treated if it's diagnosed early enough, and if it is a lower load. So if they didn't ingest as much, and there's no parameter. Well, if they ingest just this part, it just kind of depends on the horse, So supportive care typically is what you give. Fluids, they can have some electrolyte abnormalities because they're losing fluid through these ulcerations and that sort of thing, and they're losing electrolytes, so they need to be supported that way. You can try like activated charcoal and things to minimize the toxin. Activated charcoal, mineral oil, any of those things that can bind to whatever toxins in the digestive system so that it doesn't go systemically. It's tough because it is in your hay, and needle in a haystack, right? Like, and they're small little bugs. It's not like they're just going to jump out at you, or they're going to be easily seen, especially if you're feeding in the morning and you're in a hurry and you throw, 2 flakes of hay to each horse. You're not looking for blister beetles, So, it can be kind of scary because the symptoms are relatively quickly occurring, anywhere from 3 to 24 hours. So, you can start seeing some of these issues, fever and ulcerations and that sort of thing. To try to avoid it, they're most commonly found in the Midwest, Western states like Oklahoma, Kansas. They're most active in the summertime, like August, those months, July, August. So when if you're obviously concerned about that, you can find out where the hay came from. You can find out when it was cut. Typically, they tend to occur in, your later cuttings. So if you get like first cutting is less likely to have the beetle in it than a later cutting because of their life cycle and how they progress through the summer months. So, you just be aware of that thing. Like I said, I have never personally seen it, knock on wood, and I hope I don't see it. The interesting thing about that is that you remember a few years ago we were having the creeping indigo concern, right? The creeping indigo, right? So this was this weed that grows, and They can have a lot of the same symptoms, actually, with the mouth ulcerations and hypersalivation that happens with the creeping indigo. So I guess those are two different things to consider if you see this sort of thing. Creeping indigo's kind of, nobody talks about it anymore. It was kind of like hot, and everybody was worried to death about it because, obviously if you get these horses that pass because of it, it's a hot button topic, but nobody talks about it anymore. And I'm just kind of researching over this blister beetle, and I come across this, and I started thinking, well, I remember this creeping indigo thing we had, and I did see a horse that got into it a few years ago, and so it was very similar. So be careful where just be aware of where you get your hay. Try to be as informed as you can be on what cutting it is, what state it came from, those sorts of things. And if you're worried, just try to, they kind of look like like a firefly, almost like a lightning bug kind of looking thing.
Yeah, they do. And they're actually only about 1 or 2 centimeters in size. So if, like me, you're feeding sort of early in the morning in the dark, or if you're feeding it gets so dark now at 5:30 when you get home, if your hay is outdoors and it's not in a lit area, it's very, very difficult. It would be very hard to see a 1 or 2 centimeter bug in your hay. But one of the things I think I would say is buy from a quality location. Like you said, ask a lot of questions. Do you know if this hay was cut and baled immediately? Because apparently that's when they can't escape. If it was actually cut left and then baled later, that gives them a chance to run away. And I don't know that this would necessarily help, but I always shake my hay flake out completely for the horses before I leave it for them. And I would imagine if they're running around in there and you shook it out, that would alarm them somewhat, and perhaps they would take off. And so I'm just always one to shake it out and make sure it looks okay. And I would think that would help. Now, I know the clinical signs you talked about, like mouth sores. I know there can be some lethargy. I read that they can sink their whole mouth in the water trough to try and ease the discomfort of the mouth sores. Anything distinctive that you can look for that would maybe tell it from poisoning from something like a creeping indigo? And are there any really significant tests that you can do to actually prove that's what it is, to treat it?
Well, you can test for that, the toxin cantharidin. You have to, I believe it's in the fecal material. You can test for it in the fecal material. Toxemia in horses when they ingest something toxic is, clinically speaking, is pretty similar no matter what they ingest. You get this ulceration, you get possible fever, you could get diarrhea, you could get blood in the stool, any of these things that irritate the lining of the bowel, so you can test for that poison to see if it is that, but typically it takes a while for them to get the results back, and your horse is either probably going to be past or better by the time you really get the answer. Either way, you treat the horse the same. You just try to support the horse as best you can, and hope that they didn't ingest a large quantity of it. And I think your idea of shaking the hay out, and sure, any chance that the little boogers could fall on the ground, is better. So yeah.
Well, we got to wrap this segment up. A lot of information. Certainly, as I said, make sure you're getting your hay from a very reputable source. Personally, I buy my hay from Larson's in Seminole. Great quality hay, but I know there's good quality places out there you can get your hay. But ask questions. If you have any concerns or your horse shows any of these symptoms, immediately call your veterinarian, because the supportive care as soon as possible is going to certainly extend the chances of the horse making a very quick recovery. Peterson and Smith Equine Hospital, 352-237-6151. I'm here with Dr. Adam Cayot, Louisa Barton for the Horse Talk Show.